Hello everybody, my name is Lucy Collins and I'm one of the stud vets at B&W Equine Vets based in Willesley. Today I'm going to talk to you about management of the pregnant mare. So the areas that we're going to cover in the talk today are pregnancy scans, vaccinations, nutritional management, general management, worming, farriery, exercise, some things to watch out for in late gestation, and we'll talk a bit about predicting foaling, so various techniques and also the use of foaling alarms. Obviously we won't be able to ask any questions, but always feel free to give us a ring or drop us an email and we're always happy to help you where we can. So just a brief overcap in terms of what we are looking for when we're looking for pregnancies and our various scans that we perform. So first of all, following insemination and ovulation, we've got our 14-day scan, which is the first scan that we do, which many of you will be familiar with. So the image on the left is a sort of a typical 14-day scan. It's essentially a black circular structure which represents the conceptus, and we don't want to be seeing any edema around that conceptus because at this point we should be under the influence of progesterone, so there would be should be no edema. That would be a worrying sign if we were to see that. Similarly, if we saw any fluid at that point, we would be concerned. So the next scan, providing that we weren't worried about twins being a risk, in which case we would repeat a scan in 2 to 3 days time from the 14-day scan. The next scan will be our 28-day scan. So this is our heartbeat. You can see the image on the right. We've lost that regular circular structure and it's now a sort of irregular shape with our embryo proper in the middle. Now if this was a live scan, you'd be able to see a flickering little heartbeat within that embryo proper. And we tend to measure size of the conceptus at this point and also the rate of the heart rhythm and whether we're happy with that. Furthermore, with regards to our thoroughbreds, typically we would want to do a 40-day scan as well, but if we were happy with everything at 28 days, quite often that will be the last scan that we'll do. So moving on to vaccinations, typically we will vaccinate mares against influenza and tetanus. Tetanus is really key for our foals because vaccinating mares in late gestation will ensure that those antibodies are passed from the mare to the colostrum and ultimately into the foal. Influenza, the foal will get some antibodies from the mare at this point, but we won't look to vaccinate foals until they're 6 months of age, as you know. So equine herpes virus is another disease that we'll vaccinate against, especially on our larger studs. It's a nasty disease that can cause rapid premature placental separation and ultimately abortion. So we give this vaccination at 5, 7 and 9 months of pregnancy. Now, as with any vaccination, we may still see abortions, but what vaccination will be sure to do is reduce the clinical signs and definitely reduce the likelihood of these abortions occurring. Finally, rotavirus is the other common vaccine that we'll give to our pregnant mares, and this will be given at 8, 9 and 10 months of gestation. This again provides protection through the placenta, not the colostrum, as with tetanus, and rotavirus is horrible in the sense that it's very infectious and contagious. So whilst in most foals the disease will be self-limiting and foals will remain on suck despite having diarrhoea and actually relatively bright, the odd foal it'll really knock, and as I said, the key thing about this is that it's so infectious, so it spreads very rapidly. So any vaccine that will reduce the incidence and the aggressiveness of this disease spreading is advocated. So a quick point about nutritional management. I'm a vet, I'm not a nutritionist, but I can provide some brief important points about feeding our pregnant mares. So firstly, forage is really important. It's basic really. Good quality, nutritionally balanced hay or haylage, provided ad lib, is really important. You'll find with very heavily pregnant mares that they will reduce the amount they eat just before foaling purely from a lack of space. So, as I said, that's quite normal for mares to be off their food or their forage late in gestation. So concentrates, there are many different concentrates available on the market, and really the best thing is, if you're unsure, to speak to some of these feed specialists and feed companies, and they can point you in the direction of their recommended products. But as a general rule, we'll feed sort of with early pregnancy in mind, and then the last trimester of pregnancy and lactating mares again will have different nutritional and energy requirements. So a couple of important points about additional requirements for our pregnant mares. So first of all, vitamin E is an important vitamin for these mares, associated with improved fertility and antibody transfer from the mare to the foal in the form of our colostrum. Omega-3 and 6 fatty acids, which generally are incorporated into these generic stud mixes and pregnant mare mixes, so that's not something you would look to specifically supplement. And there is some evidence surrounding the use of biomass, which are supposedly helpful in mopping up unwanted bacteria, but there is a bit of scepticism surrounding this because the evidence is a little bit ambiguous. But either way, hopefully there isn't, to my knowledge, anything to suggest that this could cause harm. And just a final point, not overfeeding mares is really essential. You know, we see a lot of pregnant mares that are prone to laminitis, may even have Cushing's, and being pregnant is no exception to how we manage them. We still have to be really vigilant and make sure that we're not piling them full of sugar and excess grass, and so we get ourselves into a scenario where we've got a lame, laminitic, heavily pregnant mare, which is not easy to manage. So that's just worth bearing in mind. So a few points about general management. So it's really important to try and avoid dramatic changes too soon to foaling, because this is stressful for mares. So if we're looking to move the mare to a stud where she's going to foal, then be organised essentially and get this done a month prior to foaling, because we know that mares who are stressed become more prone to infection and picking up various diseases. So we want to try and get her there with as much time as possible so she's able to settle in, also from a herd perspective, because if she's down at the bottom pecking order and being bullied about in the field, that's also stressful. So being organised and getting the mares to stud, if that's where they're going to foal, is important. Another thing as well is just, again, being organised with regards to pre-movement tests. Sometimes we find ourselves in a situation where mares are sort of a week, 10 days away from foaling, and then the owner perhaps realises they haven't done the tests, which take 3 to 4 days. So this is just things that we can avoid, and if you're organised and get them done well in advance. So caslicks, it might be worth mentioning to the stud the mare's caslick on arrival. Similarly, if she's foaling at home, then it's really important you have a due date for these mares, and we can come out and undo the caslicks to avoid vulval tearing and traumas, which then need stitching up post-foaling. Again, all our studs will do this anyway, but if you've got few youngsters at home, few adults, etc., then it's really important that we don't mix age groups. A disease for an older foal, which such as rotavirus, might be transient and not cause them an issue, but if they're mixing with a neonatal foal, so less than 7 days old, it can be fatal to these really little foals. So not mixing age groups is really important from a parasite perspective, but predominantly from an infectious disease perspective. So that obviously requires adequate pasture and room to be able to implement this. So feeding appropriately and feeding enough, again, we've talked about that. Foaling boxes should be clean and spacious, ample bedding, and a really good biosecurity should be in place, regardless whether on a large commercial stud or just at home. You want to be making sure this environment is as clean as possible for when our our little foals are born and exposed to hopefully minimal bacterial challenges and viral challenges. So as we will go on and talk about later in the talk, multiple checks through the day and the night, especially close to the time of foaling, are really important. But we will go on to talk a bit about this later on. So a brief word on worming. Historically, we've always given pre-foaling wormers. There's a specific parasite called Strongyloides westeri, which is transmitted by the mare's milk to the foal. Almost always this is of very little relevance. It doesn't cause, very rarely causes clinical disease in the foal, may cause transient diarrhea, but it's not something that we worry about, and it's practically been eradicated with modern day worming. So really we should carry on doing what we should be doing normally, which is worm egg counts. So if the mare needs worming, then she can receive a wormer based on a worm egg count. But if she doesn't, there's actually no need to be worming these mares prior to foaling. This is because ultimately we don't want to overworm and promote resistance, which is already a big problem within veterinary. Generally, it's the mares that are actually very low risk. What's far more important on commercial studs, and especially if you've got young stock, yearlings, 2 to 3 year olds, it's actually these groups that are far more at risk, and we really have to have a good worming protocol in place to prevent problems. So a little bit about foot care. Again, breed mares sometimes have a tendency to be a bit neglected with regards to feet management and farriery. It goes without saying they need to have regular foot care. If you've got a horse, a mare that's really sore without front shoes on, if the best thing for that mare is going to be to keep those front shoes on, then so be it. Because ultimately what we want to avoid are severe lameness problems, abscesses, things that put physiological stress on our heavily pregnant mares, and essentially this can have an impact on the developing fetus. So just regular management, regular trimming, and shoes if they are necessary. Not back shoes, obviously. So a brief point about exercise. Mares can continue to be ridden in early and mid gestation, but obviously the bigger they get, it'll become a little bit more difficult. Avoiding travelling and essentially placing unnecessary stress on these mares goes without saying. So yeah, light work up until late gestation is fine should you want to keep the mare in work. And actually turnout, just a point about turnout, it is really important because quite often, especially later on in gestation, these mares will develop edema around their udder, under their bellies, possibly in their distal limbs, and turnout's really important to disperse this, as well as for their mental well-being. So in summary, if you are inexperienced and it is possible to do so, then I would really urge you to send your mare away to professional studs for foaling, because these guys know what they're doing, and we work very closely with our commercial professional studs. So if there's any problems, they will be the first to recognise it, and obviously early intervention is always going to increase the chance of a good outcome should something go wrong. Be organised in terms of vaccinations, shoes, pre-movement tests, etc. If you want more advice about nutrition, then probably best to consult one of the feed companies, and they're usually really happy to give you advice about what they think is most appropriate, and move the mares sooner rather than later to avoid stress. So just a couple of things to look at, some common and not so common abnormalities in late pregnancy. So this is a rare condition, prepubic tendon rupture. Essentially will appear initially as a small area of severe, quite painful edema, but as the condition progresses, you get to the point where these mares just have huge swelling underneath their abdomens, and that's just as a result of all the muscle that would usually hold everything in place has essentially ripped and lost its point of attachment, which is the prepubic tendon. So these mares carry a really grave prognosis. They don't do well because the reality is they've lost the ability to contract their abdominal muscles, which are really important obviously when they come to foal. So if you notice anything like this in late gestation, then this is a really serious problem, and we need to know about it to try and manage it to our best ability. It can look quite similar to a condition called hydrops, which again is rare. It's where we essentially see an excessive accumulation of allantoic fluid. These mares are just huge and abnormally large. Even to the untrained eye, they look far too big to what they should look like in late gestation. So again, these are high risk pregnancies and definitely require early veterinary intervention to establish the best way to manage them. Unfortunately, they also do carry quite a poor prognosis as well. So a couple of more common things, far more common things, are hemorrhage from the vulva. That inevitably, blood around this area in a heavily pregnant mare can sometimes cause a degree of panic, but actually quite commonly it's either as a result of vulval trauma, perhaps the mare's been kicked, or just varicose veins within the vagina which bleed readily. It's not anything to worry about and relatively easily treated. Another really important condition is premature mammary development lactation. So if you're seeing your mare bagging up, even dripping milk, way before she's due, this is a really common clinical sign of a condition called placentitis, which is infection of the placenta essentially. It's really important that we know about this because this is treatable and we can get these mares to the correct gestation length and ultimately enable them to have a healthy foal if we instigate treatment early. If it's left, then the prognosis is poor and quite often will result in abortion. But again, any signs of premature mammary development, then ring your vet because it's preventable, and we can treat it and hopefully avoid any negative consequences of the condition. So just talking a bit about predicting foaling, and then we'll go on and talk about the use of foaling alarms and various other techniques. So signs can be subtle and variable, and actually predicting foaling is ultimately down to experience and really vigilant and meticulous management and watching by stud personnel. These guys are really good at knowing when these mares are going to foal, but it ultimately comes from consistent monitoring of mares and knowing what is normal, what's not normal, and then essentially being able to establish when they think these mares are going to foal. So we talk a lot about waxing up, relaxation of the sacroiliac and pelvic ligaments. Again, you can see how these things are subjective, and actually what they rely on is consistent monitoring to know that subtle changes are occurring. Just monitoring every other day isn't sufficient because these subtle changes can easily be missed. So our normal gestation length is 320 to 365 days. Foals born before 320 days are very high risk, and they're a topic in their own, so we won't talk too much about that now. As a general rule, foalings are easy and usually problem-free. Unfortunately, the ones that aren't straightforward tend to be fairly catastrophic, so attending the foaling is really important because if there are issues, we need to know about them very quickly in order to avoid nasty outcomes. So these aren't really methods that are commonly used, but we'll talk a bit about them because they're quite interesting. So a couple of methods have been described by the reference at the top to predict foaling. So firstly, measuring pH of milk of the mare. using sort of paper strips or small digital machines. And what we know is that prior to birth, the pH drops, it becomes more acidic. This is actually a really rapid test and requires minimal equipment, and it has what we call good positive predictive value, i.e. it's useful for predicting when she will foal. Another test we can look at are changes in electrolytes of the milk. So calcium and magnesium change prior to foaling. We know that calcium increases prior to birth. However, this test is a little bit more complex and requires more accuracy and time, and it has what we call good negative predictive value, which essentially means it's useful for predicting when she won't foal, which isn't really that useful because what we really want to know is when she will foal. Finally, we can use refractometers, which many of you will have, to measure the quality of the colostrum to predict when she's going to foal. So as I said, these are tests that are not commonly used. They're more scientific and they're not particularly practical, but they're quite useful to know about. So things that can help us predict foaling. So as I've emphasised before, and I will re-emphasise now, the importance of monitoring and checking just cannot be emphasised enough. That's ultimately what is going to be our answer to knowing when these mares are going to foal. But there are some things that we can use to provide you with more sleep during the night and hopefully give you a good indication of when these mares are foaling. So alarms are something that some studs, some clients use. Essentially what they are little transponders which are fitted on one side of the vulva, and then there's a little transponder chip which goes onto the other side of the vulva. They slot into each other. Then obviously as a mare starts to foal, relying on the foal being in a normal position, this puts pressure on the alarm and the little magnet pops out and automatically phones a mobile phone to alert the owner to the fact the mare is foaling. There's a good link here which describes how these are fitted on YouTube if you are interested. So sort of comparing advantages and disadvantages of foaling alarms and why we might and might not use them. So advantages, they're actually very effective when they activate, is the long and short of it. They require minimal input from manager and owner, because once we've fitted them, then it's just a case of ensuring the stud personnel or owner has their phone on them all the time should that alarm be activated. For a lot of people, they provide reassurance. It's just another way of knowing when she's going to foal, and means they're not solely relying on themselves checking the mare. So just provides that additional reassurance. Kind of a similar point, but it reduces the need for constant checking, and it might just mean you get an extra hour of sleep through the night. Useful if you have limited staff available, so unless you're on a big commercial stud where they have shift workers or people staying up all night and that's their sole job, if it's just you on your own at home with your one mare, then actually they can be really quite useful. They're useful if you've got lots of mares predicted to foal at a similar time, again, while you might be checking one bunch and the mare might be starting to foal, so it just gives you that flexibility and makes you one step ahead of things. You can rent them instead of buying, which can reduce cost. So looking at disadvantages, the main disadvantage is really that these alarms will not be activated if there's a dystocia. So if this foal is in the wrong presentation, if it's breached or presented in a dorsal transverse position, back first for example, the vulva will not become separated and the alarm won't activate. So if you are solely relying on these alarms to tell you when the mares are going to foal and there is a problem, they will not help you in this scenario. Obviously there is the cost of us as vets placing the alarm, which for most people will be insignificant, but it's still something to consider. The actual cost of the alarm is important to consider. it's around £1,200 just from my basic Google search for one receiver and transmitter, so the costs aren't insignificant. It can cause tearing and trauma of the vulva, especially if they're put in too early or they become loose, or the mare rubs her vulva on a fence post or whatever, and it causes it to move positions, and that's frustrating because it can just cause the disfiguration to vulvas, and we end up doing lots of suturing and casset repairs, and that's not ideal. They don't always activate. As with any technology, it's great when it's great, but occasionally it won't work, and that can be frustrating. As I said, it should not be relied upon as a sole means of predicting foaling. Really, we need people with experience and expertise to, as well as these devices, to know exactly when things are going wrong, because, as I said, these are fine when things are normal, but when there's a dystocia, when there's an abnormal foaling, we need experienced personnel on hand straight away. So as I've briefly alluded to, they shouldn't be fitted more than 5 to 7 days to foaling to prevent them being rubbed or changing position, which then might affect their efficacy. So in summary, really they're no replacement for experienced personnel predicting foaling. They are good in combination with experienced people. As I said as well, the main issue with them is the fact they're unable to predict when things are going wrong. So you can't replace the role of a knowledgeable human in these circumstances. If cost permits, they are useful in combination with continued vigilant monitoring of the mare.